Okay, Assalamualaikum warahmatullahi taala wabarakatuh. Welcome to the channel. Okay, for today, our team will be presenting regarding scopolamine. Okay, my name is Muhammad Irfan bin Muhammad Haturami. I'll be introducing our teammates. Okay, we have Brother Haruma Nakamoto, Brother Izzat Izri, Brother Aiman, I can't recall the last name, and Brother Ishak bin Buhari. Okay, thus, without further ado, I will first start the presentation with the overview of the presentation. Okay, firstly, what is scopolamine? Scopolamine, or also known as hyoscine, is a tropane alkaloid-derived drugs from plants that is in the Solanaceae family, particularly that is also known as belladonna. Okay. Okay, for the pharmacokinetics, in terms of absorption of scopolamine, scopolamine have the oral bioavailability of 20 and up to 40%. Okay, the peak plasma concentration of scopolamine can occur up to between 0.5 hours after the administration of scopolamine. Okay, metabolism of scopolamine is usually being metabolized in the liver by the TYP3A enzyme, and scopolamine also undergoes the oxidative demethylation and glucuronide conjugation. In terms of excretion of scopolamine, they are particularly being excreted by the urine, which is up to 30% of the dosage that have been recovered as the metabolites once they have been metabolized in the liver. Next slide, please. Okay, for the excretion, the half-life of the scopolamine is around 105 minutes after the introduction of scopolamine via IV administration. The administration routes can either be through transdermal patch, which can be steadily released for 3 days in terms of 0.5 milligram dosage. And the other routes of administration is the IV administration, which usually results in higher peak serum concentrations of scopolamine. I think I will pass the floor to the next presenter.
Now I will explain on the pharmacodynamics. So, scopolamine used to treat the post-operative nausea, vomiting, and motion sickness. And how did the scopolamine cause its effect? Scopolamine blocked the action of acetylcholine at the muscarinic receptor in the central nervous system, as you can see in the picture here. And the therapeutic effect of this drug is that it can cause antiemetic, which means it blocks the muscarinic acetylcholine receptor, and it will reduce the signal that cause nausea and vomiting for those who are triggered by the motion sickness. And as for the anti-salivary scopolamine, inhibits the muscarinic receptor in the salivary glands and reducing parasympathetic stimulation, and which will then cause the reduce in saliva.
Okay, so next is the mechanism of action for scopolamine. So as we know, scopolamine is a non-selective competitive antagonist. What does it mean? It means that it is non-selective, so it will bind to any muscarinic receptors, and not specifically it is non-selective, but it is competitive antagonist. What does it mean by competitive antagonist? It means that it competes with acetylcholine to bind with the postsynaptic neuron, which has the receptor of acetylcholine. So as we know, muscarinic receptors, its neurotransmitter is acetylcholine. So scopolamine will competitively bind the postsynaptic neuron, and it inhibits acetylcholine from binding to the receptor, which also inhibits the action of acetylcholine. This can be known also as anti-cholinergic antagonist. So scopolamine competitively binds to the postsynaptic neuron receptor instead of acetylcholine. So without acetylcholine, so because acetylcholine is the neurotransmitter, so without it, it inhibits any downstream of signaling that would normally occur following acetylcholine binding. So without acetylcholine, so the signaling will be inhibited, and no actual action will be occurred. So it reduces the cholinergic signaling to both central and peripheral nervous system. So what happens depends on what receptor that is affected. So next slide. So this inhibition affects various physiological functions, including movement, contraction, glandular secretion, and also central nervous system signaling. As I mentioned before, scopolamine can bind to any muscarinic receptors, and as we know that there are 5 muscarinic receptors: M1, M2, M3, and M4, and M5. So for M1 receptor, if scopolamine binds to the muscarinic receptor of M1, as we know, muscarinic receptor subtype M1 is primarily location is in the central nervous system and also gastric glands. So the antagonistic effects of scopolamine are sedation, hallucination, confusion, which are common CNS effects. It can also impair memory and lead to cognitive dysfunction, and also it leads to reduced gastric acid secretion because M1 muscarinic receptor, its location is at the gastric glands. So for muscarinic receptor subtype M2, its primary location is at the heart, more or less at the AV nodes. So the antagonistic effects of scopolamine, if it binds to the muscarinic receptor subtype M2, it can cause tachycardia, which is decrease of heart rate due to the inhibition of parasympathetic effects, and also it can potentially lead to arrhythmia, which is irregular heart rhythms. For M3 subtype, its location is mainly on smooth muscles such as the GI tract and also the bronchial muscles. So we can see that its antagonistic effects are decreased smooth muscle contraction, which leads to reduce of GI motility, which also leads to constipation, and also reduce of glandular secretion, which can be seen as symptoms like dry mouth, dry skin, and also reduce of sweating. And also bronchodilation, which is the dilation of the bronchial muscles, and it dilates the bronchus. And also lastly, for M4 and the M5 subtype, there are less understood diseases are integrated in some neuromuscular effects and potential therapeutic adaptation, but because M4 and M5 are mainly primarily central nervous system. For the antagonistic effects, it leads to CNS effects, as I said before, sedation, confusion, disorientation, and hallucination, because it is due to the effects of the cholinergic pathway in the brain, and also it can potentially lead to disruptive cognitive and perceptual function, again, because it locates at the central nervous system. So next presenter.
So as for the current issues regarding scopolamine, number one, as a side effect, it can cause severe dizziness and hallucination to those who are registered this drug. Secondly, due to the drug's ability to make a patient become hallucinative, it is also used in criminal activities. So like people, for example, people in South America, they like to use this drug purposely in order to make people unconscious and then lure them into doing criminal activities such as robbery or raping or things like that. Hence, this drug is also known as devil's breath. And number three, this drug also has a degree of addictiveness for people with recurrent recreational use, meaning that even though this drug is not as much as addictive as drugs such as cocaine, recurrent recreational use of this drug, since it can give you the hallucination, which makes you feel like you're in dreamland, right? So recurrent use of this drug can lead to negative consequences. Next, please.
Okay, thank you, Brother Aruma. Okay, so for the Islamic perspective, we took Surah Al-An'am, verse 99, for our Islamic perspective. So here are the verse and the meaning. Next slide, please. From Surah Al-An'am, verse 99, we can identify that Allah created everything around us for a reason. Everything around us can give benefit to us, like plants. There are many types of plants that can be used for cooking, treating wounds, and also making medicine. For example, like the drug scopolamine. The drug scopolamine comes from a plant in the Solanaceae family called Atropa belladonna. In fact, there are many things that can be created only from its plants because every part of the plant can be used, such as its leaves and fruits. So this shows that we can take advantage of all creations, which can be one way to show gratitude and appreciate each of its creations. So as the conclusion, scopolamine is a type of drug that can help to treat and manage PONV, motion sickness, and other disease due to its cholinergic properties. Apart from that, usage of scopolamine need always to be observed by the experts since its toxic can give side effects to the user, like blurred vision and dilated pupils, especially who are allergic with it. So scopolamine is one of the very useful drugs since it's widely used for treating variety disease. So I think that's all from us. Thank you.